Hello everyone and welcome to my channel. Today I will be talking about prostate cancer, a condition that affects men aged 50 and over. Please join me in this awareness creation on health matters for men. This series is going to be a very informative section that will support our fathers, grandfathers, husbands and sons. Remember, this is not a diagnostic session, so please see a medical doctor for adequate diagnosis if you have any concern about your health. The male reproductive system is made up of internal and external parts, and together these organs function to achieve urination, sexual intercourse, and producing children. The male reproductive system includes a group of organs that make up a man's reproductive and urinary systems. These organs produce, maintain, transport sperm cells and semen, discharge sperm into female reproductive tract, and secrete male sex hormones. The external parts of the male reproductive system includes the penis, the scrotum, and the testicles or testes. The penis is the male organ that becomes rigid and erects when filled with blood, allowing for penetration during sex. At the tip of the penis is the opening of the urethra and transports both semen and urine out of the body. The scrotum is the pouch-like sac of skin that hangs behind the penis. It holds and protects the testicles, as well as providing a climate control system. For normal sperm development, the testes must be at a temperature slightly cooler than the body's temperature. So, if you are wondering why that part of the body is always cooler than the rest, please note that it is for sperm development purposes. The testicles are responsible for producing sperm and testosterone, the primary male sex hormone, and they produce sperm cells that are stored in the epididymis. The internal male reproductive organs include the vas deferens, a long muscular tube that connects the epididymis with the urethra, and its function is to transport matured sperm for ejaculation. The seminal vesicles lies above the prostate gland and function in the production of sugar-rich fluid that provides sperm cells with a source of energy. The fluid is also sticky so that semen stays in the vagina long enough for a sperm to fertilize an egg. The union of the vas deferens with the duct of the seminal vesicle is the ejaculatory duct that empties into the urethra, the tube that carries urine from the bladder to outside of the body. The flow of urine is blocked from the urethra during sex, allowing only semen to be ejaculated at orgasm. Located on the sides of the urethra is the corpus gland or bulbourethral gland. They produce alkaline fluid that empties directly into the urethra, lubricating it and also neutralizing acidity of residual droplets of urine and of the vagina. The prostate gland surrounds the urethra that carries both urine and seminal fluid to the urethra opening. It is a part of the male reproductive system responsible for making and storing seminal or prostatic fluid. Prostatic fluid nourishes and transports semen, as well as neutralizing the acidic environment of the vagina. Prostate-specific antigen in prostatic fluid renders thickened semen runnier, aiding sperm travel through it more easily, increasing their possibility of successfully fertilizing an egg. The seminal fluid is alkaline and protects the sperm from the acidic environment of the vagina so that they can stay alive and continue their journey to the egg. During ejaculation, the prostate squeezes the prostatic fluid into the urethra, thereby expelling sperm as part of the semen. The prostate can be enlarged, and this is a condition in men aged 50 and over. Prostate enlargement is a benign condition that could be mild in some, but could be very troublesome in others, affecting urination. The cause of prostate enlargement is not known, but could be linked to hormonal changes as a man gets older. If the prostate becomes enlarged, it can place pressure on the bladder and the urethra. This could cause difficulties in starting urination and fully emptying the bladder. A need for frequent urination could also be experienced. Prostate cancer is the most common cancer in men, and it usually develops slowly, so there may be no signs of the disease for many years. This cancer is the most common cause of death after lung cancer. Prostate cancer develops when the rate of cell division exceeds those of cell death. Symptoms of prostate cancer do not usually appear until the prostate is large enough to affect the urethra that carries urine from the bladder out of the body. Most men with early prostate cancer do not have any signs or symptoms. However, early symptoms of the condition can be experienced if the cancer grows near the tube or urethra and presses against it, changing the way of urination. Symptoms of prostate cancer include slow urinary streaming, hesitancy, incomplete emptying, frequency, nighttime bathroom trips, and pain or burning sensation while passing urine. Other symptoms experienced include edema in lower extremities, enlarged lymph nodes, mental confusion, bowel obstructions, and impotence. These symptoms do not confirm prostate cancer and could be likely caused by something else like prostate enlargement. It is important to see a medical professional for adequate diagnosis of prostate cancer. The cause of prostate cancer is not known, but certain factors can increase the risk of developing the condition. Diet with high calorie intake, high fat red meats and dairy products are associated with increased risk of prostate cancer. Chronic inflammation from infectious agents, hormonal changes, physical trauma, urinary reflux, and dietary intake of carcinogens are risk factors for development of prostate cancer. The chances of developing prostate cancer increases with age, as most cases are diagnosed in men aged 50 or older. Prostate cancer is more common in men of African, Caribbean, or African descent, and less common in Asian men. Men whose father or brother were affected by prostate cancer are at slightly increased risk themselves. Research also suggests that obesity increases the risk of prostate cancer. Diagnosis and screening for prostate cancer includes digital rectal examination, DRE, blood tests to check for prostate-specific antigen, PSA, transrectal ultrasound, TRUS, and other imaging such as MRI. Diagnosis of the disease is confirmed through tissue biopsy and histological processes. PSA blood test is not specific to prostate cancer, as the level can also be raised by other conditions like non-cancerous conditions such as enlarged prostate, prostate inflammation, infection, or trauma. Prostate cancer can be treated if diagnosed in the early stages, and there are surgical and non-surgical treatment options. Prostate cancer incidence increases with age, and most times the symptoms are expressed at an advanced stage of the disease. We must support our fathers, grandfathers, and family members on this subject. Thanks for watching, and please like and share this video to your friends and family, and I will see you soon.